I'm sure most of you or many of you have heard the news about President Biden and his recent diagnosis of prostate cancer. I've had a lot of friends and patients and family reaching out to say, hey, what does this mean? What is this cancer that maybe I'm aware of on the periphery? But if someone like President Biden can be diagnosed with this, what does this mean for me? What should I be doing anything different? How do I interpret this news? So a little bit of information about that. President Biden was diagnosed with Gleason 9 prostate cancer, which would be ranked a type of fairly aggressive cancer. Right. Whenever I'm discussing prostate cancer, there's a few factors that are important in terms of assessing what we're dealing with. Right. Number one is the grade of the cancer. Right. There's two grading systems. One is a bit more historic, and that's the Gleason scoring system. And the second is a grade group scoring system, right? So the one that we've used for decades and decades is the Gleason system. And in that, you can have a score ranging from 6 to 10, right? Obviously, that can be a bit confusing, right? What happened to grades 1 through 5, right? Why are we starting at 6? You tell someone you have Gleason 6 prostate cancer, they instantly think, oh my gosh, that's pretty severe, right? 6 is not the lowest number, right? But Gleason 6 is actually, in this system, the lowest risk in terms of the prostate cancer grade, and that goes all the way up to a score of 10, right, potentially. Functionally, most people kind of cap out around a grade of 9, right? So in that Gleason scoring system, a grade of 9 would signify very advanced, fairly aggressive prostate cancer. These are the types of prostate cancer cells that have differentiated to a point where they're, very abnormal, where they're not acting the way a normal prostate cell would in basically any shape or form. And that makes it more likely for those cells to leave the prostate and grow in a different organ. In the case of Mr. Biden, President Biden, that cancer is growing in the bones, right, far away from the original organ of the prostate. Whenever people are diagnosed with prostate cancer, we also need to pay close attention to the patient's goals and how old they are and what the prognosis is. So for someone like President Biden, who's diagnosed with the cancer in his 80s, oftentimes for slow-growing prostate cancers, it may not be as much of a concern. With lower risk prostate cancers that are grade group 1 or Gleason 3+3, oftentimes we'll choose to watch and observe and perform something called active surveillance for lower risk. However, as prostate cancer gets more aggressive, when you start to deal with grade group 4 or 5, which amounts to the Gleason, 8, 9, 10 prostate cancers, those are the prostate cancers that, if left unchecked, can grow very quickly. In those cases, we follow something called doubling time, right? That's where the markers for the prostate cancer or the cancer itself, where we measure how quickly it takes for those to increase by twofold. In President Biden's case with Gleason 9 prostate cancer, usually the doubling times are going to be shorter, indicating a more aggressive disease. And if I were his urologist, I'd be very curious to know what his previous PSAs had done if we have that information. We've known that hormones play an important role in prostate cancer for decades. So back in the 1980s, if you developed prostate cancer, or 1970s, you might be treated with with castration, where the men's testicle would be removed to lower testosterone. However, we've kind of progressed beyond that to medications that can perform a similar goal, either by injection or by oral medication, in terms of lowering the testosterone levels within the body. In addition to that, there's even newer medications now that work at a intracellular level. These medications actually work to block the testosterone receptor. And between those two, we can kind of starve the prostate cancer of the fuel that helps to feed the cancer and tell it to grow. In the case of President Biden, when they say that it is hormone sensitive, it means that the cancer appears to respond to taking away that testosterone as a source of fuel, and that tends to put the cancer into hibernation to slow or stop the growth.